Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we'll be on location at Smile Design Studio in Bethesda, Maryland, discussing how we can help all of us achieve a good night's sleep and what treatment options are available with two of this area's top dentists, Dr. Maria Wright as well as Dr. Treva Willis. Dr. Wright received her Doctor of Dental Surgery degree from the University of Maryland and trained in the American Academy of Dental Sleep Medicine. Dr. Willis received her Doctor of Dental degree from the University of Maryland and has trained in TMJ disorders at the world-renowned Pankey Institute in Key Biscayne, Florida. Welcome, Dr. Wright and Dr. Willis.
Thank you.
In fact, it's your second time, Dr. Willis.
Yes.
I remember you from the past, and your first time, Dr. Wright.
Yes.
We've got a lot to talk about, so let me just begin, if I may, by asking you, Dr. Willis, if you can tell us, for all of us, so many of us, millions of us who have a hard time getting a good night's sleep, what stops us or hinders us from getting a good night's sleep? Let's begin with that.
Sure. There's, of course, there's many things that can, hinder us from getting a good night's sleep. We all experience stress and, the daily things that we go through. But in terms of jaw disorders, there's a few things that can cause us to not get a good, restful night's sleep. Headache pain, back pain, neck pain can all hinder the reparative phase and cause us not to really sleep as well as we think we are, and it can interfere with daily productivity and cause fatigue during the day.
And this is related, it can be related directly to the jaw, I take it?
Yes, that's correct.
Interesting. And speaking of the jaw, Dr. Willis, can you please show us what that means?
Absolutely. Lots of times, if the jaw doesn't fit together properly, there are several components that can cause you not to get a good night's sleep. There's the muscle component, there's the joint, and there's the teeth. All three of those have to work together in harmony in order for you to find a good restful position for your face and to reduce discomfort. If one of those doesn't fit together properly, it can cause muscle spasms, which can in turn cause neck and back pain, or even headache pain.
Interesting. So basically everything needs to be in harmony and balance between all three of those vital areas to really be able to get a good night's sleep. And if something is misaligned or out of position in any of those areas along the face and the jaw, we're looking at some difficult sleep.
It can cause problems. You go through 4 sleep cycles each night, and there's one cycle that's very important in repairing and rest. So even though you may be physically thinking that you're sleeping, not reaching that reparative phase because you're just generally uncomfortable may cause you not to get restful sleep, and then in turn produce fatigue and cause productivity issues during the day.
Okay, we're here with Jerry. He's one of millions of sufferers from sleep apnea and sleep apnea related disorders. How would you say it's affected your life, Jerry?
I would say that it has affected my life where no one wants to be around me when I'm trying to sleep. There's a lot of noise, and they are very agitated because they can't get any sleep because I'm snoring and trying to breathe and choking and everything else. So it really put a toll on my family, my kids, my wife.
You know, and that's something that a lot of folks can relate to, because you're right, it's not just you, and that's bad enough right there, not being able to get a good night's sleep and all that entails, but the toll it takes on your family as well. So then if we fast forward through your life, you're here now, you've come to Dr. Wright. Tell me what's next for you.
Hopefully it will be silence, good night's sleep, and hopefully I could make everyone else happy that they be able to get some quiet time, some sleeping time. And for me, I really want to get that proper rest so that I can feel a lot better.
Well, we'd love to have you back on, Jerry, and updating us on how you are at that time. How's that sound?
Sounds great.
All right, and get a good night's sleep if you can.
Try to.
All right, thanks. Nice meeting you.
You too.
I wanted to ask you, Dr. Willis, speaking on the same theme along the lines of what we've been talking about, what other sleep disorders, or are there any other sleep disorders, I should say, more specifically, that can be caused by jaw position?
Yes, in addition to the issues that I mentioned before, the grinding of the teeth or the muscle spasms, there are other disorders that can cause you not to get a good restful night's sleep. Some even interfere with your actual breathing. Dr. Maria Wright has studied extensively in the areas of sleep medicine, so she probably would be a better person to go into this subject.
Well, I appreciate that, Dr. Willis, and that brings me to you, Dr. Wright, and I wanted to ask you along those lines, can you please elaborate on how the jaw position relates to sleep disorders so we have a real understanding?
Okay, Dr. Willis, what she is referring to is obstructive sleep apnea, and the jaw position plays a role in this serious medical condition. Obstructive sleep apnea occurs when your tongue and soft tissues fall to the back of your throat, and in which your airway is blocked.
Oh my God, talk about dangerous. Because we all hear about, unfortunately and tragically, people every year passing away, in their sleep due to sleep apnea problems. Obviously, the Hall of Fame defensive end Reggie White comes to mind as among one of those. And I wanted to follow that up by asking you, Dr. Wright, what are some common signs?
One of the most common signs is loud snoring. Although loud snoring can be harmless, a lot of times we're finding that approximately 1/2 of patients that snore are suffering from obstructive sleep apnea.
That is a very high number because we know there's many, many millions of folks that snore out there. And what you just said is basically approximately half of all of those have a version of sleep apnea.
Yes, very alarming. And what is happening when these patients are sleeping is that they literally stop breathing from 10 to 30 seconds, sometimes 1 minute or longer, hundreds of times throughout the night.
My goodness, talk about increasing the risk for something of a tragic nature possibly happening, which does every year to so many people.
Exactly, and which that does is increases their risk of more serious conditions such as heart attack, high blood pressure, obesity, diabetes. And we all know without a good night's sleep that, you're at an increased risk of car accidents as well.
Yes, indeed. Now, how, Dr. Wright, can this be treated? What's out there, what's available, and how effective is it?
Well, the first step is that you have to be diagnosed, and this occurs at a sleep center. At the sleep center, the sleep physician there will take measurements of your heart rate, take a look at your breathing patterns, also your oxygen level in your blood. Once you're diagnosed, some simple lifestyle changes such as exercise and losing weight are effective. Most of the time, the gold standard of care is a patient wearing a CPAP machine. In addition to that, surgery is sometimes indicated. However, we're finding that 25 to 50% of patients cannot tolerate and are not compliant with the CPAP machine. They find them very uncomfortable and cumbersome and a little bit of an inconvenience, especially if they're traveling and they're carrying a large machine around with them. A great alternative that I custom fit for patients is an oral appliance that they wear during the night, which they find a lot more tolerable.
Well, that's certainly good to know that that's available. And yeah, and I'm surprised. I didn't realize that number was that high. 25 to 50% of all folks out there who use the CPAP, it's not tolerable for them. They just can't use it, even though that would help them. So to know that there's an oral appliance that you obviously make over here and offer for your patients to help them get those results, that's very good to know, doctor. How would this oral appliance, that's a great alternative to the CPAP, how would that work?
Well, the oral appliance resembles a sport mouth guard. What it does is that it repositions your jaw and also your tongue and uvula so that it opens your airway so that you're able to breathe at night.
Which is very significant. So it sounds like it does the job.
Some of the great qualities of this oral device is that it's more convenient for the patient, more comfortable, and in addition to that, it's also non-invasive.
Oh, that's very interesting and good to know indeed, Dr. Wright. Dr. Willis, I understand we're going to see a patient consult.
Yes, we're going to interview a patient and just kind of get a feel for some of the questions that one would experience when we're trying to diagnose a patient that has a sleep disorder, either due to sleep apnea or facial discomfort, TMJ disorder.
All right, let's go take a look at it.
Sure. Leah, I'd like you to just give me a little bit of background on what brought you into the office today. What are you having problems with? Are you having facial pain or discomfort?
I suffer from migraine headaches, and I've exhausted all of my options, basically. And I was watching something about TMJ disorder and how it connects to migraine headaches. And I'm feeling a lot of pain right here, and basically the pain starts right in this area. And I'm not sure whether it's because I grind my teeth at night or stress, but it just goes, it starts here and then it goes all through my face. Is that something that's due to grinding at night or clenching your teeth?
It can be. It can be related to the muscle pain that you're having, pulling on the jaw in an abnormal fashion. It can also be related to the position of the teeth and the teeth not fitting together properly, and the teeth not fitting together properly causing the muscles to pull in an abnormal fashion. So our goal is going to be to find out which one of those things are not in harmony and to try to correct that for you.
Can you explain to me exactly what TMJ disorder is?
Sure, absolutely. There's three components. There's your muscle, there's your teeth, and there's the actual joint.
Okay.
Any dysfunction in either one of these, or all three of these, can contribute to what's called TMJ disorder. This is your temporomandibular joint, and if you're having a problem in any of these three different components, it can be classified as a TMJ disorder.
How do you determine if I have the disorder or not?
Well, listening to your concerns and the issues that you're having, I think we should set you up for an exam.
Okay.
We're going to do an exam where we actually test these muscles. We're going to do some diagnostic testing. We may do some ultrasound. We may do some scans. And we also may just test some range of motion. But we'd like to do a very thorough evaluation of all of these components to find out exactly where the problem lies in order to be able to properly diagnose it and treat it correctly.
Dr. Willis, are there studies that connect the TMJ disorder with migraine headaches?
Absolutely, absolutely. As you can see on my little skull here, there is a muscle that's located in where you pointed to, which is called the temporal area. There's also muscles that are in the back of the head and the neck, and all of these muscles can contribute to head pain, which is interpreted then as sometimes migraine or headache pain.
I must say there's quite a bit involved with the consult in this case.
Yes, the exam, although we just kind of got started, usually takes about an hour and a half.
Dr. Willis, I wanted to ask you, what separates you and your practice apart from so many of the others, because you all have developed quite a strong reputation in dental excellence, patient care, certainly in this region?
Well, we like to pride ourselves on our comprehensive team approach. Our practice is centered on oral health and wellness. We like to make sure that we have everything that the patient can possibly need in terms of diagnosis and examination in order to achieve those goals.
Well, on that note, I'd like to thank you, Dr. Willis, and you as well, Dr. Wright, for joining us and being guests in our programs. It was really quite educational and informative indeed.
Thank you for having us.
Thank you.
It was our pleasure.